Hi everyone, welcome to Occupational Medicine Pearls podcast. I'm Yi and your host for today. We are tackling a topic that is literally height stakes, working at heights. It is one of the leading causes of serious injury and death in Australia, and the rules are more nuanced than just telling people don't fall. We're going to need to break it down into hierarchy of controls and what are the laws governing the safety around working at heights. And finally, we will cover the medical checkup process needed for all the workers working in such a precarious environment. As doctors, we perform pre-placement medicals for many workers working in construction industry. And some workers come with working at heights requests, some don't. And it is our job to inquire about what does the role involve and whether people need to spend time above the ground. For example, if there is a medical for an electrician, some electricians need to work at above ground, while some do not. So we need to understand that clearly. Let's start. Falls hazards are found in many workplaces where work is carried out at heights. For example, stacking shelves in a warehouse or retail outlet, working on a roof, and loading a large truck, or accessing silos. Falls can also occur at ground level into holes, for example, trenches of surface pits. In Australia, if a worker is operating at a height more than 2 meters in a construction site, this is officially regarded as high-risk construction work. It means that the employer or PCBU need to have a safe work method statement which perform the risk assessment and provide the controls that are done to minimize the harm. Controls for fall management could include starting with elimination. When possible, work should be carried out on the ground and transfer the materials later. If it is not possible, there has to be a safe system of work to provide adequate protection from falls. So that may include fall prevention device. It can be barriers, scaffolding, or elevator working platform. If it is not possible, a work positioning system such as industrial rope access system should be placed. And that would be people who are cleaning the tall buildings. Afterwards, if it is not possible to have either of them, there should be a fall arrest system which stops a worker from having serious injuries from the impact. For example, that may include safety net or catch platform. Now we look at medical assessment component of determining fitness for working at heights. Working at heights can be physically demanding and psychologically challenging. That's why covering all the risk factors that can make someone have sudden incapacitation at a higher risk situation is very much important. It starts with a good history. The history to screen with any medical related symptoms can be quite long. There can be pages of medical questions, and they are designed if there is any history of previous illness that could have impact on the ability, we can screen them at this stage. So starting with overall physical capacity, so someone need to have a good ability with bending, squatting, gripping, pushing and pulling. We need to explore previous history of joint pain or any musculoskeletal issues, and if they have them, are they currently stable? Does the worker require any active treatment? And that could change the fitness. Also, if the worker has implants or prosthetic, whether they would interfere with climbing or safety equipment. After that, we think about balance and coordination, any history of head injury, any episodes of vertigo or dizziness, either diagnosed or undiagnosed, any history of balance disorders. Can they have sudden incapacitation due to migraine, fits or blackout or seizures? That's important. And then we look at any history of stroke, any concussion, any neurological condition that can impact workers' health. So afterwards, we go down to heart, which is important. So generally, we want to look at any history of sudden death in the family, any episodes of palpitation, chest pain, or any shortness of breath that may explain any underlying heart condition. Even in young people, conditions such as arrhythmia or congenital heart disease can present without showing symptoms. When the worker is older, we also need to think about cardiovascular risk assessment, and that may include performing resting ECG and blood tests to calculate the score. Regarding the lungs, there is no specific requirement about asthma, but if there is any condition such as COPD, that may impact overall fitness to perform the role. Another risk factor is that if someone is working at heights, they need certain level of fitness, which the lung conditions may prohibit from performing. A worker needs good eyesight for both distance and near, and also they need to have working level of hearing. If they have pre-existing tinnitus or ringing sound in the ear, or pre-existing hearing loss, that need to be documented thoroughly. Afterwards, we go down to psychological health. Do they have any pre-existing history with any anxiety, depression? Are they higher risk of causing self-harm or suicide? Or do they have any history of mentioning of hearer heights? Because that would be quite strange for that role. And does the worker have any history of sleep apnea or any sleep disorders? That's important because fatigue can be dangerous when there is very little room for error. What medication are they currently taking? Any medication causing them to have low blood pressure, blackout, or fatigue? Are they taking any pain medication, any sleeping tablet, anything that can cause sedation? That need to be important. Afterwards, any other medical condition related to fitness are more or less in the overall health rather than specific requirement. In women, we also need to think about, are they currently pregnant, so that we need to consider for the safety and counsel appropriately. In certain work such as linesman, there may be exposure to higher power electromagnetic fields compared to someone who is working from far away. For example, communication towers. So if they have implants like pacemaker or cochlear implants, that may be affected by the strong electromagnetic fields. If I concluded, working at heights is similar to any other safety critical role, that the worker requires good overall health and fitness, and it is not just one-off fitness assessment, it is ongoing monitoring and ongoing assessment to keep the workplace safe. I hope this episode is useful, and we'll talk to you later. Bye.